Welcome back. It is a pain that most of us will encounter at some point in our lives. Unfortunately, it goes with the territory, I guess, hip and knee pain. But fortunately, doctors and researchers are working hard to find new ways and new treatments for these problems. And joining us now is Dr. Longenecker. He is part of the team over at Jacksonville Orthopaedic Institute. Sir, it's good to see you. Thank you for being here. There's been a few studies that you have been a part of that are targeting just this. So what are you researching? What are you hoping to find out? And then what will the results of this then, how will it benefit people who are suffering?
Well, I'm currently working with a company called United Orthopaedics, who is a foreign company, believe it or not, that produces excellent total joints. I got involved with them because I was looking for a small company that was responsive to my needs, and that's exactly what United is. Now, they're a foreign company that is putting out joints in 38 different countries, but for me, I'm bringing that implant to the United States market. I flew to Taiwan and looked at the factory, and the tolerances there were better than anything I've seen. And I've been involved with many companies in the United States over the years, and it's just fun to work with a young new company that lets you do things on the fly.
Yeah, and talk about what you hope your research will yield and what you're specifically targeting in these studies.
Well, we bring patients who graciously consent to us following them and seeing how they do. And the point of this is for the company is to compare and show that the product is equal to or better than other products in the marketplace. We all use the same basic studies, techniques to follow joints, and you can compare one company to the other using that.
So you brought some examples. Let's talk about what you specifically think this product could do to help make the lives of those better and what you're hoping to achieve ultimately.
Well, there's a lot of things that happen in the total joint world. For instance, in a knee, I do several hundred knees a year, and I pride myself on the fact that my infection rate is virtually zero. It's 1 in 8,000 knees. Part of what makes that happen is the ability to do things quickly. And for instance, this is a jig that I was supplied. It's a very novel jig. It allows me to do a lot of things that, if you think about it, you're using this to guide the first cuts. Well, it was giving me trouble, so I told the company I really need to thin these out so that they'll fit under and I don't have to change the position of the knee to make the jig fit. This was back to me in 1 week.
Wow.
If I posed that to some of the big companies I've worked for before, it would go to a committee who would think it over, and maybe a year later it would happen.
Is this just, when you think about how technology is evolving and how getting products created into market, you know, especially something as complicated as this?
But think about that. That saves me 3 minutes in the OR. So my operating room time goes from 45 to 42 minutes. Which
in essence results in what?
It results in less trauma to the knee. The longer you leave a wound open, the more likely it is to become infected, the more trouble you'll have with skin edges getting dehydrated, and therefore the wounds take longer to heal. And when you do all that, you start getting faster, quicker results. And
do you hope that this now is something that other surgeons will be able to use and you'll be able to create through this company and provide? Or I know Jacksonville Orthopaedic is, you know, obviously on the cutting edge, no pun intended, but will you see this go beyond?
I think it will, but it won't be for another 3 or 4 years because these studies run out to 5 years before the data comes in. We just appreciate those patients that come in and are willing to be a part of the study, but what it really means to them is they're going to be followed extremely closely, and we're going to know exactly how well they did.
Yeah, let's talk about that for people. Is this study still going on for people who might be having the surgery for a knee replacement? Is it a knee total replacement?
The knee replacement is wide open right now. I just started that study, and they just started that study in the United States. We're just about finished with the hip study, but those people who have enrolled will be followed for 5 years.
Okay, and so there is still time for those people who want to enroll can do so?
Oh, yeah.
Okay, and what would, you know, some people say, oh, I don't know if I want to be a part of a what does that mean to be a part of a study?
Well, believe it or not, it doesn't mean that much other than how closely we follow. I still use the same implant regardless. I've done the homework on the implants. The implants are excellent. So even if they didn't enroll in the study, I'd still be using that implant to do their surgery.
And so this is just another way of getting, you know, essentially the same care, but you're kind of followed a little bit more closely because of the research that you need.
And what I've seen so far, these products are really performing excellently, not good, excellently. They're as good or better than anything I've used prior to now.
There you go. Good to see you, sir. Thanks for
Thank
taking
you.
the time. I know you have a busy day. Back to work. Appreciate you joining
My
us
pleasure.
here on the show. And thanks to Jacksonville Orthopaedic Institute, of course, for coming on and making this possible. For more information, you can log on to their website, which is joi.net. You can also call their Riverside number, which is 904-388-1400.